Good morning. Megan here from Wisteria Dental Care with your latest edition of Tooth Talk Tuesday. Today I wanted to talk with you about a pretty serious medical condition that is affecting a really large population in the United States. Truly is becoming what I think is an epidemic, and that is sleep-related breathing disorders and obstructive sleep apnea. So in 2017, the American Dental Association put out a white paper encouraging dental professionals to start screening our patients for sleep-related breathing disorders and sleep apnea due to the oral structures, tissue and skeletal structure that can, be linked with obstructive sleep apnea. Oftentimes these oral structures are part of what is causing the condition, and we are looking directly at those structures every single day. So we have been tasked, in the dental community to help to screen our patients and make sure that we are doing everything we can to keep our patients healthy. So we have recently really started to up our game here at Wisteria Dental Care. We want to make sure that we're screening all of our patients, children and adults, because sleep apnea does not just affect adults, it's people of all ages. It's a really common and serious medical condition, and the definition is the definition of sleep apnea is when a person stops breathing for 10 seconds or more repeatedly during sleep. There is a whole spectrum, however, of sleep-related breathing disorders, anywhere from snoring. The next step is upper airway resistance syndrome, followed by obstructive sleep apnea. So there is a continuum. Just because somebody, isn't diagnosed with sleep apnea doesn't mean that they don't have some type of sleep breathing disorder. So we are screening our patients along that entire spectrum. So the prevalence of obstructive sleep apnea in the United States alone is estimated to be at about 37% of the population, which is about 170 million people. That's a lot. It's a lot of people, and people of all ages, like I said, affecting children and adults. And you have to think, if we're grouping in some other sleep and breathing disorders with that number, the estimated amount is going to be a lot higher. That's a lot of people suffering, not getting quality sleep, having their poor quality sleep affecting their health. And we're talking about, when you don't get good quality sleep, you're at an increased risk for heart disease, hypertension, autoimmune disorders, Alzheimer's, you name it, because what happens is you have an increase in inflammation in your body, and just like all my talks that I've given on periodontal disease, and that chronic inflammatory state is not good for all of the systems in your body. So over time we see a deterioration due to the decreased oxygen levels that come along with obstructive sleep apnea, and that poor quality sleep. It's like your body is constantly in fight or flight mode because you're not getting proper sleep. So it's that increased stress level, increased inflammation that really causes that deterioration in health. So what we've started doing here in the office is providing all of our patients with a screening form, just with some questions to find out how you're sleeping. Do you sleep well? Do you wake up rested? Do you snore? Do you wake up frequently at night to go to the bathroom? Because not normal, you shouldn't be waking up to go to the bathroom. For children, do you have any ADHD symptoms? Because in children, that is often how it presents, as behavioral and attention deficit issues. So, it's a really broad spectrum, but we have those screening forms that we provide to all of our patients. The other thing that we're doing is if we see any red flags popping up either in our oral exam or on that screening form, we are sending our patients home with home sleep tests to help screen them. And we're doing that in the form of a sleep ring. So the way that this works is the patient just pops it on their finger. They wear it overnight. This ring actually syncs up to an app on a phone or a tablet, and will record heart rate and blood oxygen levels throughout the night. Uses a technology called cardiac coupling, which is FDA approved for the diagnosis of sleep apnea. So we have the patients use this ring for 3 consecutive nights, and then we send those test results off to a sleep physician for review, for them to take a look and see what's going on, and if they see any areas of concern, then they get back to us and we refer out for consultation. We have partnered with Empower Sleep to help us, with screening our patients, and they've been amazing. They've been helping our patients quite a bit. Once we get back the results from the sleep physician, then, we move forward. There's different types of treatments. Sometimes, patients need CPAP. Sometimes they need some type of oral appliance therapy, which we can help with here at the office. So come on in and see us, get your sleep screening, let us take a look, and because the truth is, by screening our patients, we really could be saving someone's life, and it's really important to us. So come on in, come to see us. Take care. Have a great day.